We are live now, Doctor.
Thank you. So good evening, everyone. Welcome all of you to this first webinar of TNOA 2024 towards excellence and approaching Faico practical exam horizons and beyond. So on behalf of TNOA Managing Committee and all our members, we wish you all a very happy, prosperous and productive new year. And so we are starting with one important topic this year. The exams are nearing. We thought will help the young ophthalmologists who are preparing for their exams. So let us contribute, support and help them towards their journey. So this is the initiative by the TNOA Young Ophthalmologists Task Force. Has been doing a wonderful job since last August, and really thankful to Dr. Nishant, Dr. Prasanna and the entire young ophthalmologist team for doing many programs. Almost all the programs are now hit the 1,000 views mark, so which means we are realizing our objectives and gaining traction in our path towards excellence. So I congratulate the young ophthalmologist team for taking all the initiatives and steps and doing a wonderful job. Thank you, Prasanna and Nishant. So this January, I've already released the calendar for TNOA January calendar. So we have this webinar today, the first TNOA Thursday webinar. Next Thursday, we have a program on wellness committee. So organized by Dr. Arvind and Dr. Ravikumar. This will be an interactive session with a cardiologist on NCDs and this cardiac diseases. So how to prevent and how to approach wellness from that angle. The third week, we have a program by the academic committee. So this will be for the exam going PGs, case presentations. So that will be on the third week of January. And of course, all of you know that 27th and 28th, we are having our TNOA mid-year meet. So this mid-year meet is scheduled at Yeligiri. So we've already circulated the program and all the invites. Over 200 members will be joining us at Yeligiri for a relaxed meet to reconnect and refresh. So once again, I welcome all of you for this meeting to reconnect. And this will be a both academic and non-academic session. We are starting with a wellness program, trek to Swami Malai in the Yeligiri Hills, which is one of the famous treks in Yeligiri. And then we have a session, a mixed session, debate and financial management and practice management session. We have a leadership session and then the entertainment night, as well as debate on various academic for this mid-year meet. In February, we have our mid-year managing committee meet, and from then onwards, we'll be releasing the February calendar. So please stay tuned to all the TNOA programs. All the members, please attend these programs and be part of all this learning experience. So now for this webinar, we have a experience and very active chairperson, particularly in this topic. I welcome Dr. A.K. Grover, who is a chairperson for this webinar, and Dr. M. Loganathan, who is the co-chairperson. I welcome all the speakers, Dr. Sishir, Dr. Tushar Grover, Dr. Shreyans, Dr. Renal Pandit, Dr. Jain Karthip, Dr. Swati, and Dr. Gunjan Sahuja. We also have a senior ophthalmologist panel, Dr. Rajalakshmi, Dr. Nirupama, and Dr. Preeti Uday. And of course, it will be moderated by Dr. Nishant and Anujit with our convener, Dr. Prasanna. I welcome all the YO panel members for this session. And of course, all our office bearers who have been working in front and behind all these activities. So thank you, managing committee members, for joining us as well as supporting us. And with this, I hand over the proceedings to Dr. Nishant and Dr. Anurjit to take over. So once again, I welcome our chairperson, Dr. A.K. Grover, has done a wonderful job, particularly when Prasanna told me about this topic. There was only one person who came to our mind. Sir was instrumental in initiating Faico in the initial journey. So I was part of the first few years as coordinators for Tamil Nadu. Sir was instrumental in bringing the syllabus and the Faico curriculum, and then special making it speciality oriented also, along with Dr. Asad and all the senior members. So he'll be the right person to chair this session and give his keynote address. Of course, that will be eye opener for not only us but also for young ophthalmologists taking this important exam. It's a wonderful exam. It has helped many of us to learn a lot on the practical as well as to brush our theoretical knowledge. So all of you who are going to take this exam, all the best, and wish you a big learning experience. Over to you, the moderators, Nishant and Dr. Anurjit.
Thank you, sir. We'll have a few words from Dr. A.K. Grover, sir, before we go into the program. Respected sir, a few words from you on this particular initiative, and please do share your wisdom on this, sir. Thank you, sir.
Thank you, Dr. Prasanna. Thank you, Dr. Nirmal. Thank you, Dr. Loganathan. It's a privilege to be a part of this program. I'm so glad that you conceptualized this program and brought it to fruition. This is the first program that I've seen on Faico being conducted, and all credit to the young ophthalmologists for thinking it up. There is a lot to be thought about subspecialty education, about education and learning in general. And I will talk about that in a brief keynote if you want right now, or would you like it to be sometime later?
You can have it now, sir.
No, should be fine, sir. Yeah.
Okay. So essentially, let me begin with my screen sharing. So can you see my screen now?
Yes, sir.
Yes, sir.
So I'll begin by thanking you all for this initiative. And before I talk about the fellowship and the collegium and introduction to subspecialty education and collegium, let's talk a little bit about what education is all about, what learning is all about. We'll begin with the quotation by Albert Einstein, who said, "Wisdom is not what you learn at school, but it is a product of a deliberate, special effort at acquiring it all our lives." So that is the basic purpose that we want to have the right kind of wisdom to choose the right course in our lives. Oxford Dictionary says that education is the process of teaching or learning. But it's not the rote learning or the fact learning which is important, especially in an era like today, when we have everything on our fingertips in our phones, on Google or whatever, or ChatGPT or whatever. So education is what we gain during the process of learning or education. And that is the analytical ability, the wisdom, and the skills that we acquire during that period. So that essentially is what we need to know of whenever we think of an exam, whenever we think of an education. That it is your ability to look at a patient, to sift through the facts, to sift through the findings, to analyze them to get to the core of what needs to be done. Learning is never easy, takes a lot of effort. You do not have a smooth course. You will falter ever so often, but you do get up again. And every time you have to have the positivity to go on and acquire more and more facts, more and more knowledge, more and more analytical ability to lead to the right kind of thinking process or the wisdom. So let's go on to collegium. What is the collegium and why was it created? What are these education and learning objectives of the collegium? Now, collegium of the IIS, which Dr. Nirmal was referring to, was done in the year 2010, principally with the objective of promotion of high quality subspecialty training. Now, why is subspecialty training important? In any of the undergraduate or the graduate program, the institutions which have the subspecialty programs would give a much better training. And your residency education is dependent on whether you have the subspecialties in your institution and whether you have the subspecialty teachers. So this has a direct bearing on the residency training and training of ophthalmic manpower. The era today is that of rational and evidence-based management, and that comes only when we have enough emphasis on subspecialty training. And you can only go on to discern what you need to know about your country, about your own needs through your own research if you have subspecialty training. So the collegium thought of picking up the subspecialty education in the country through developing the appropriate curricula for training and assessment, through accreditation of ophthalmic institutions for subspecialty training programs to make sure that they provide the right kind of education and uniformity in standards, and award fellowships, thereby certifying that the right kind of training has been provided, which can form the basis for those people going on to the appropriate institutions to give the right kind of education to others. Now let's look at the status globally. Now we need to define the status of subspecialty education as it is around the globe. We need to see what has been done with regard to subspecialty curricula, subspecialty examinations, and how these have been adapted in subspecialty services, and what has been done with regard to subspecialty programs globally. So let's see what the geographic spread of the subspecialty education is. I was chairing the subspecialty committee of the International Council of Ophthalmology for 10 years, and we did a survey of 42 countries. We got a response from 42 countries around the globe, which revealed that subspecialty education is still in a primitive stage across most of the countries. It is poorly developed in 90% of the countries that responded. Subspecialty societies do not exist in almost half the countries, and only 29% have an existing subspecialty curriculum. And exit exams for subspecialty exist only in 20% of the countries. And there was no international subspecialty examination. And that's what we worked for. And we started the ICO subspecialty examination as well, which worked with the AIOS Collegium exam for a number of years. Subspecialty curricula are important to have if we want to give standardized and qualitatively good training in subspecialties. Because if we teach students what is not up to that point, we are robbing them of their tomorrow. If we teach them by the methods of yesterday, we rob them of tomorrow. So subspecialty curricula were developed by the effort of the International Council of Ophthalmology, and 5 subspecialties developed a fully developed curriculum for these specialities. The others have not yet been done. So what did the Collegium do? So Collegium adapted many of those curricula, created many of our own, and created these guidelines when I was the president of the Collegium in 2015. We worked with leading institutions in the country to develop a consensus document, and we created all subspecialty committees. Dr. Nirmal was a part of the process. These recommendations were reviewed by subject experts and by all the membership of the IOS and was endorsed by the GBM, and this document was created out. This is a 350-page consensus document which carries a number of information which we'll talk about. Now, this was revised in 2022 when I again took over as the president of the Collegium, and it was released in AIS Mumbai, and this is available to us on the AIUS website. So these are the subspecialties that Faico has, and these are the examinations that are held for fellowship by the Collegium. So the curriculum has laid down the guidelines for the subspecialties. It gives the objectives, it gives the duration that these programs should have and what they should cover. It also talks about what should be the admission criteria for fellowships. It talks about how the institutions should be organized to carry out the subspecialty programs. It determines what the faculty qualifications should be for those who carry out these teaching programs for subspecialties, and the details of institutional facilities and resources are laid down. Contents of the curriculum are detailed at basic, standard, and advanced, and it talks about cognitive as well as the technical and surgical skills. It goes on to define the minimum number of diagnostic therapeutic procedures each candidate must do in his period of fellowship, and it also lays down the minimum facilities and equipments that a center should have to be accredited for subspecialty training. It also lays down how the assessment in the fellowship program should be done, both during the course of the fellowship and at the end. Talks about professionalism, ethics, interpersonal and communication skills. It talks about evaluation of these programs and about continuing professional development for the fellows of the Collegium. Now, the requirements of accreditation have been detailed, which talk about what curriculum they should follow, institutional environment, human resources, equipment and training material, number of patients that they should have, and the rest of the logistics that they should have. The purpose is to standardize fellowship training throughout the country, and this is a work in progress. Accreditation should be started in all our institutions in order to achieve uniformity in subspecialty training. So this is the objective that we are working towards in order to create subspecialists with the highest expertise. And this is what the Collegium examination wants to determine. So as we said, the objective of creating these subspecialists, which we examine through the fellowship program, are that it will improve the residency training, promote rational and evidence-based patient care, and advance research in areas that are important for us. So these are the objectives. And with this, I think you will now have a context of why and how the examination is being held. We're trying to constantly improve it. We have created a new question bank this time, and we're trying to distribute it well according to the curriculum, assigning each question to a particular part of the curriculum to ensure that the entire width of the curriculum is covered. We're also trying to make sure that it has the right mix of difficult, easy, and normal standard questions. We're also trying to undertake the process of standardization and validation of questions and a proper standard setting so that an exam, if it has very difficult question, does not mean that nobody passes in that specialty. These have been the lacunae over the last few years in the exams, which we are trying to overcome now. And the AUS with Dr. Santosh Anawar is also working on this. He's in fact brought about a new exam for the residency level as well. So those things will bring about a qualitative change in the fellowship exam very soon, and you will notice that in the coming days with the new question bank, new subspecialty groups having come in to create the paper, and we will make sure that every year improvements are carried out in the question bank to give you the appropriate examination and the appropriate subspecialty training. But being a part of the medical profession, let's not forget once again these important things. As Dalai Lama said, when educating the minds of our youth, we must not forget to educate their hearts. Our hearts must be in the right place. We are in patient care, we are dealing with patients. Again, Aristotle said, educating the brain without educating the heart is no education at all. And this is what we will need to remember as medical professionals. Thank you very much again for this opportunity to talk to you. Thank you, Dr. Nirmal. Thank you, team, TNOA. Thank you, young ophthalmologists.
Thank you so much, sir. That's indeed very nice of you to join us for this first meeting and tell about educating not only the brain but also the heart. So it's a wonderful thought process, and I'm sure we'll be taking this forward in the next few months and year. So we now have our senior members. We have our past president, Dr. Thangavelu, and Dr. Sriram. So I request them to share a few words since being the first meeting of the new year. Over to you, sir, Dr. Thangavelu. He also happens to be the advisor to the president for this year. Dr. Thangavelu, sir.
Good evening, everybody. Good evening, sir. Ashok Grover.
How are you? Nice to see you.
Happy New Year to you.
Thank you.
Happy New Year to all the TNOA members, especially the executive committee members. Thank you, Dr. Nirmal, for asking me to say a few words. Very happy New Year. I think we have started with a good note this year, and we have a lot of programs ahead for this month itself. So end of this month, we are having the TNOA mid-year meeting, which has a lot of practical topics to be discussed and learned also. It would be nice if Dr. Grover can take off from there and come and join us for the mid-year also. It will be nice. For a long time, we can meet together.
I will.
Yeah, it will be nice, very nice. So it's a nice place to relax, nice place to learn also, and nice friends to meet also. So it will be nice if you could come down to the. So thank you, Dr. Nirmal. See, I think it's we were together, and that's the time when you launched this Faico program at Delhi. Dr. Nirmal and myself are the representatives of TNOA. It was very nice, and many of them have benefited. Each year I see the people who have been benefited out of this program, Faico program. Thank you, Dr. Grover, for this initiative which you have taken long time back, 2010, if I'm right, for taking this initiative. Thank you, Dr. Nirmal. I once again wish everybody and advance Pongal wishes. It's a very grandly celebrated Tamil Nadu festival of harvest. So we all enjoy this festival. So wishing everybody a happy Pongal, and we'll meet at Yelagiri. Thank you very much. Thank you, Dr. Grover, for your presence.
Thank you. Thank you, Dr. Thangavelu.
So now I request Dr. Sriram Gopal. Sriram, are you here?
Yes, sir.
I know you are in the middle of busy practice.
No, sir, I've just finished work, so no problem.
You can wish our young colleagues all the best for their exams, as well as invite for all the TNOA programs.
Thank you, sir. Thank you, Dr. Nirmala, dear President. One of my mentors for my FRCS exam, Dr. Grover, sir. I remember coming and meeting you 20 years ago in the hospital, and a lot of other esteemed teachers. Thank you for giving such a wonderful opportunity. Another one of my well-wishers, Dr. Thangavelu, sir. Good evening, sir. Loganathan, good friend, and all other co-office bearers of TNOA and all the people who took so much effort to put this program together. I'm sure that all the people, the students logging in will realize what a wonderful opportunity this is, because it takes me back 20 years when we were actually running from pillar to post trying to find who has taken an exam, a particular for FRCS or FICO, to get certain inputs and certain tips from them. But now it is being handed to them in a platter. So I'm sure a lot of people will log in, and even in future, many people will log in and keep looking at this again and again to get what they want at the palm of their hand. Thank you so much.
Thank you, Sriram. Yes, it is indeed a wonderful resource. What we are creating or what we are discussing today is not only for today, but also for consumption and as well as resource in the future. So whoever is going to take the exams, this will be a very useful resource to go back and look into. So it's a lot of energy and wisdom here, and that will be there forever in TNOA website. So whenever you want look into some resource about Faico, so you can log into TNOA website and get all the resources needed in one place and one click. So with this technology helping us, let's move on, and over to you, Dr. Prasanna and Anujit and Nishant to take over this program.
Yes, sir. Thank you, Nirmal sir, and for the team TNOA U task force. So Nirmal sir, all the office bearers of TNOA, and our core members, Anujit being one who conceptualized this program. So this is the fifth installment of the series under this 2023-2024 tenure. We started with two innovations capsules where unlocking innovations were done by all our TNOA U members. Then we had exams which were more related to FRCS and FRCO, which were horizons and beyond. And we had career guidance, and the milestones, as our president told, can see all our speaks for itself. And today we are for this enlightening Faico exams, and we had a wonderful keynote address by A.K. Grover sir. And we are just going to start it now. Over to you, Anujit, to call the first speaker, Dr. Shishir Varghese sir.
Thank you so much, sir. I'm just going to share my screen. A very warm welcome to everyone present over here. Without further ado, we can begin the proceedings for this evening. Right at the outset, we'd start with our first talk, that is approaching your FICO retina exam. And for that, we have presenting Dr. Shishir Varghese, sir. Dr. Shishir is currently a managing director and consultant with retina surgeon at the Amita Eye Care Institute at Kerala. He's a fellow with retinal surgery and an ex-consultant at Arvind Hospital, Coimbatore, with 40 PubMed Index publications, as well as 4 international awards and numerous presentations in national and international conferences to his credit. With that, sir, I'd ask you to share your screen and you can go ahead with your presentation, sir.
Yeah, are the slides visible?
Yes, sir, it's visible.
Yes, they are. Full screen. Yes, full screen, sir.
So thank you, TNOA and your TNOA for giving me this opportunity. So I'll be talking about acing your Faico retina exam. So since I'm just starting off, I'll just give a brief on what all is actually required to apply for it. So you must be an AIOS member, and you need to have your MS degree post-graduation, obviously, and then you should have at least 1 year practical experience in the specialty. So even if you have not done a fellowship, you need to get a letter or recommendation letter from your institute and tell them that you have a particular experience of at least 1 year in that specialty, and then you can apply for the Faico exam. So an institutional letter or a fellowship completion certificate, along with your medical council registration, and with your degree certificate. So then you'll be eligible to write your Faico exam. So form and fee. So now earlier it used to be 5,000. So now it's a demand draft of 10,000 payable at Delhi. And then this form, you can download it from www.aios.org, or you can use this QR code to scan and you can download the form. So after filling it up, so you can send it by mail to the office and they'll give you the admit card via mail. So what about the format? So earlier it used to be a 1 hour theory exam with 60 questions. So from this year onwards, it's 2 hours, theory exam with 100 questions. And it was a 70% pass mark, which is still at the same, and there is no negative marking. So how do you prepare for the theory? So theory, just let me tell you, there is nothing practical in theory. Theory is like, it's basically pure theory, pure MCQs, pure theoretical questions. And some of the books which are required to cover, study from your theory, I've given it here and I've uploaded it to OneDrive. You can scan the QR code and get these books. So the aim of your exam is to get maximum number of MCQs correct. So then only you will be able to qualify for the for your practicals in FICO. So just start doing MCQs, MCQs, MCQs rather than reading up theory. The aim, you need to just cover up and read your MCQs and from multiple books. So few of these books have given uploaded online, and those who are interested can download from using this QR code. Online also, there is quite a lot of material for solving and doing MCQs. So one of them is the IQ, that is iDocs, that is by the by UK. You can either do a free version or a paid version of it. So there are multiple MCQs, but it's in all of ophthalmology. For the retina, you can particularly choose out the retina questions and solve the MCQs online. The other area where you will get multiple MCQs as well as case studies as case reports or grand rounds is the digital journal ophthalmology platform online. From there also you can solve a lot of MCQs, as well as it's beneficial for your practical exams also, FICO exams also. And then there is the One Network by American Academy of Ophthalmology. You need to make an account and log in, and then there'll be a lot of MCQs. You'll get around 130 or 140 questions, and then you can sit and solve those MCQs. So by solving one MCQ, you get a detailed explanation on the answer. So you learn a lot of things just by solving one MCQ. You'll get to know all about it and all around it and other details also. So these are a pretty good online area MCQ platforms where you can actually, which will help you in your step one exam. eOphtha is a good website. It does not have MCQs, but it does have presentations as well as good detail about some practical things like lenses and dyes in retina. So that's you can read a basic of some of your theory from eOphtha. Then the other area where you can solve some MCQs are the MRC of by Professor Chuha. So there also you get to solve a lot of MCQs. You can select out the retina ones and solve the retina MCQs. So the another thing which is there in the theory exam of FICO is you will be asked the year as well as who invented what or who discovered what. So there is this page on iWiki, History of Ophthalmology, where you get the list of important inventions done. You can choose out the retina ones and you can learn who invented what. For example, who invented the vitrectomy cutter, Dr. Robert Makimer in Germany, and which year. So all those things you can learn from this iWiki. So the difficult questions in the theory exams usually in which year it was invented or who invented what, who discovered VEGF. So few of those questions will be like that to basically cut you up apart from the rest of the crowd. So if you go through this, it'll be quite beneficial. So what all questions can be asked? So you can be asked, like I said, history, person, year, a little bit on the embryology, anatomy can be asked. So investigative modalities about ERG waves, FFA, ICGA, you should know the concentration, binding capacities, how much, which one is more protein binding, the concentration of eye drops, or tropicamide, phenylephrine, what is the concentration used in ROP, what are the concentration of the intravitreal antibiotics, which ones are more commonly used, how do you inject, the guidelines of the latest ROP classification guidelines, something on pachychoroid disease, pneumatic retinopexy, concentrations of gas used, and then dye concentrations, something on RBOs and DME. So these will be all pure theoretical questions. Something about instruments, the size or which buckle will you use? What are the dimensions of your ocutome? What is the inner diameter of the 27 cutter? Then the frequency of your lasers, you need to know in and out of all the lasers, double frequency, Nd:YAG, the yellow laser, the diode laser, the PDT. And you'll also be asked on studies, the Bravo study or the CRVO study. They'll give you 4 options and then you have to choose how much milligram of steroid was used for this in the CRVO study or in the Bravo study, like that. and something on recent advances, newer drugs, anti-VEGFs, which are there in the current pipeline, like Luxturna, Pegcetacoplan for age-related macular dry AMD and geographic atrophy. So stage 2. So once you clear your theory, you will go on to stage 2 and stage 3. So the OSCE and the Viva actually depends on which center has been allotted for the exam. So this time the 2023-24 FICO practical is retina is being held in Chankrathila, Chennai. So during my, so these are few of the books where you can read the OSCEs from, like I mentioned already, DJO. And then there is one on OSCE book by Dr. Amar Agrawal. And there is another practical guide to Viva and OSCE in ophthalmology. So these are, I have uploaded in the website. You can scan the QR code and download it. This Kansky Test Yourself Atlas is quite good. It's for the whole of ophthalmology, but you can select out the retina fundus pictures and, solve the OSCE from there. And DGO is an online platform. They'll also have quite a lot of OSCEs to this thing. So what all can be asked in OSCE? So during my exam, I was asked about this buckles, bands, which one it was used for, 287 band, intraocular foreign body, X-ray of an intraocular foreign body, choroidal melanoma with subretinal fluid, retinoblastoma slide, flexor intestinal rosettes or Homer-Wright's rosettes. Then you can be asked about an FFA, the pattern of FFA of the disease, something on OCT, what kind of edema, cystoid edema. Then you may also be asked lenses. The lenses will be kept there. You may be asked how much field you can actually see with those lenses. Then the ERG waveform, what type of ERG, normal, photoptic, scotoptic, all those things. And even cutter also was kept a 25 gauge and the internal diameter was asked. So these are the few things which can be kept for the OSCEs. Now, Viva is actually purely dependent on the examiner. So it's basically what you pick up from your daily clinics during your fellowship or during your training in the particular specialty of retina. So it'll be basics of examination, imaging basics. So for example, they'll ask you, how do you differentiate endophthalmitis vitritis from a vitreous hemorrhage on B scan? So you have to say that, B scan is not the pure thing to differentiate. You need to go for the clinical exam, see whether the patient has pain, redness, and things like that. So imaging basics, something on imaging also can be asked, on basics on how to treat a retinal disease, and some new studies. They may be asked which study was done for the current anti-VEGF and things like that. So these are the things which can be asked for your Viva. So it's good after you get through to your exam, you get to go on stage and get the certificate during the AIOS. And I like to acknowledge Dr. Pooja, who's currently giving her exam. She has helped me with the latest exam, the questions. She has helped me actually to tell me what all was there in the current examination. And thank you.
Thank you so much, sir. That was very extensive, and I think everyone will appreciate the fact that you took the effort to put all the books on your drive and share the QR code. Even for those looking into this presentation later, it's very helpful. With that, I'd like to, yes. So with that, we'd like to go on to the
Just one comment.
senior ophthalmic.
Yes.
May I make a comment?
Yes.
Yeah,
Thank you,
yeah.
Dr. Varghese. That was an excellent presentation.
Thank you.
Just one comment, that we always had 70% as the pass marks. And the concept was that maybe those who pass are very good. And then the screening at the practical level can be relatively simple. And the pass percentage generally had been 30%, 25%, but some subspecialties, it was very poor. And that had been a constant nagging point. So what we've done is brought a new question bank from this time onwards. And we have started following a process of standard setting, which was followed by the way they gives a reasonable percentage of passing. So we don't really that tightly adhere to 70%, did not adhere to that 70% this year. And we may follow that process of standard setting for each exam from next exam onwards also, so that we can have a reasonable pass percentage without at all compromising on the standard. So that rigid 70% may not persist. That's what I wanted to say.
Okay. Thank you.
Thank you.
Thank you. Thank you so much, sir. I think that's very relieving for a lot of people who are listening as well. With that, I'd like to call our co-chairperson also, Dr. Loganathan, sir. also has a lot of experience in this field as well. Sir, can you share your 2 cents on the FICO exams and your experience? Shishir, I'd request you to stop sharing your screen.
Sure.
Thank you so much, sir.
Nathan, sir, you're on mute, sir.
Yeah. So good evening. Is it audible?
Yes, sir, audible,
Yes.
sir.
Thank you, President, and welcome, sir, Prover, sir. So first, I want to convey my regards to Faico Grover, sir. He was my examiner for the Faico exam. So it's my honor to be sitting next to the sir with as a co-chairperson. My namaskar, sir. Oh. Then Faico, like what exactly the first speaker told. So it starts preparing from your day one in the post graduation. So, like my mentor, like Professor R.K. Everyone knows. I fortunate to have to work with oculoplasty. Then I developed interest based on it. And most of these things I take notes when I am attending like the Dians in the orbited oculoplasty like Professor Eke Grover and Santosh, and I read all the AAO materials. Those times way back in 2003-4, that time we preparing, that time this much materials weren't available. So we depends upon the teacher's notes, and actually that helps a lot in both your routine practical exam as well as in the Viva as well as in the OSCE pattern. So that time in 2013, that was the South Asia meet along with in Hyderabad, where I received my first FAICO fellowship award. That time actually less materials, but with a lot of teachers, we used to go from wherever the conference held. We used to go even the other states. Nowadays everything is online. That time not much of online mixing. So with a lot of notes from the teachers and the expert in the particular field, which helped us to, I was the only one selected that time from the orbit and aquaplasty in theory as well as in the practical from the Tamil Nadu. So that was the FAICO exams for me. So I think with the available lot of materials and the associations are also doing lot of helps to the budding ophthalmologists and residents. With that, easily they can go through if they start contributing from their side.
Thank you.
Thank you. So, with that, on to, we have a lot of participants on the Yo panel who are also FICO exam attendees or who have passed FICO exams as well. Dr. Neha Mohan, ma'am, are you there?
Yeah, hi, Anushita. I'm there, but my camera is not working. I'm so sorry.
Yeah, I just wanted to ask you to share your experience with the FICO Retina exam and your pointers for those who will be taking the exam this year.
Yeah, I think I would first like to congratulate Dr. Varghese. I think he was really nice and extensive in explaining the exam. And had he been in my times, I think, it's really nice to be guided like that. But at the same time, I think it's a little scary because it sounds like, there is so much to read. And half of them would not fill the exam thinking that itna detail mein kaun jayega, I think. So but I personally, so I gave it before COVID times, I think in 2018 maybe. And I personally thought that the retina exam is not that theoretical actually, because my husband was appearing for the cornea FICO since 2-3 years, and I got the impression that it's too theoretical, and but retina wasn't. So retina is quite practical also. Now getting a OCT and all is, I think it's more of practical than of a theoretical thing. Of course, there are these exclusive questions which are to score for those who can score more. But if you have good clinical sense of retina, and obviously that books that he has mentioned are really good, and especially that Kansky book I really like. So that gets you into the groove of doing the multiple choice questions. That is a must, because our minds are right now off MCQ, so you have to train yourself again back to the MCQ thing. And so I think anybody who has a good experience in retina, like, as it is mentioned, at least a year of work should be there in the subspecialty. Retina FICO is theory at least is not that difficult. And OSCE is just like any OSCE that we used to give in our graduation or post graduations, and they are simple. They are uh, obviously you have to think, but they are not that out of the world kind of questions. And I remember my exam was in Ames, so there were 4 5 chambers where the vivas are going on, and in few chambers it was quite study oriented. When was the study held, what was the objective, and I think that gets little tough. And a lot of them flung who were actually asked about a lot of studies, because remembering each study in detail is quite difficult, but I was lucky enough to get away with ROP. So I think that's pure luck where you fall. But I think anybody who's aspiring for FICO Retina must just do the MCQs under the guidance that Dr. Verghese gave, and I think it should go good.
Thank you so much, ma'am. Thank you for sharing your life experience as well as your center and what exactly happens. This is, I think, why this webinar is becoming really useful for our juniors, because we are getting a direct idea about where the centers are, what are the questions asked, and what the experience has been.
Yeah,
With that, I thank you so much.
thank you.
With that, I'll share once more, and we can go on to inviting the next speaker. Prasanna sir, are you there?
Yeah, yes, Anujit. So next on stage, we like to call upon Dr. Tushar Grover, who has pursued his Master of Surgery in Ophthalmology from Arvind Eye Hospital, Madurai, and he has completed his fellowship in cornea refractive and cataract surgery from Narayan Netralaya, Bangalore. He has delivered numerous invited faculty talks and research papers at various national and international forums, and has various publications, and he has completed FICO in cornea and refractive surgery. Over to you, Dr. Tushar sir, for the enlightening capsule talk on your specialty in FICO.
Thank you so much, Dr. Prasanna. I'll just share my screen. All right, so my gratitude to the UO Task Force and to TNOA for having me here. So I'll be talking about the cornea FAICO. And I mean, there are multiple ways to go about it, I'm sure. And I'll primarily be discussing what I think was helpful to me. And I'll be grouping it into how to prepare for the exam, and how to go about writing the exam. So starting with the preparation, and I'll be focusing more on the practical because that's coming up soon. So a little bit about the theory, but more on the OSCE and Viva. So one thing that definitely helped me a lot, which Dr. Shishir also pointed out, is the MCQ books. The ones that I felt were useful to me were the ONE network MCQs by AAO and something called as Off the Question. So I have these PDFs and I'll be happy to share it. So this is totally about 500 questions because the Off the Questions has many bonus questions as well. And this is useful not just for your theory, but also for your OSCE, because most of these questions are clinical scenarios, are clinical images that are given to you. And this is pretty much how a lot of your OSCE questions are going to be framed as well. So even if you've cleared your theory and are preparing for the OSCE, I would still suggest that you go through the MCQs. And even if you've gone through the MCQs for the theory, brush it up once again now for the practicals as well. Other than that, I would recommend going through one of the cornea atlases as well. I wouldn't recommend you reading big textbooks at this stage because I don't think this is the time for it. You already read all of that during your training, you read that during your work. So I would now suggest focusing more on things like a cornea atlas. Get your identification of different conditions right, because in your OSCE, you will be getting a lot of images, asked to diagnose them, and then answering subsequent questions. The other thing is to be extremely thorough with the interpretation of various diagnostic scans. So it's extremely likely that you might get an image of a specular microscopy and asked questions about the diagnosis, asked other questions about the investigative modality or the condition itself. Similarly, with corneal tomography, anterior segment OCT, and various other diagnostic modalities in cornea. I had quite a few questions in the cornea as well as in the refractive OSCE where there was an image of a diagnostic scan given and I had to we had to interpret that, diagnose it, and answer questions on that. So this is again extremely important. The other thing is to know your instruments very well. So all the commonly used instruments in corneal surgeries, you will definitely be asked some of them in your viva. And this eventually leads on to a discussion about the surgeries that are used, they are used for. So know your surgeries very well, watch surgical videos. You might also get images of surgical complications in your OSCE. So it's important to know those as well. And there's definitely going to be a lot of discussion on your corneal surgeries in the viva as well. So it's extremely important to be thorough with all the surgical steps and surgical complications. There are quite a few mock OSCEs that are available now. iLearn is a nice website for these resources. There is a mock OSCE on corneal investigations. There is a mock OSCE on corneal dystrophies as well. And these two are probably the most important topics. You will definitely have a good number of questions on both these topics in your OSCE. And again, there are these revised guidelines now which mention what the AIOS expects from a cornea fellow, and therefore look at what is needed in this and the things they expect out of you, the skills and the acumen that they expect out of you, and areas where you feel you are weak. It would be nice to brush up your knowledge in those areas. So moving on to writing the exam, well, very simple things. It's important that you take a good look at the image before you answer. Sometimes the diagnosis might be a little confusing, and it might be intentionally so. The examiner might intentionally have an image there which would confuse you. So be very careful when you take a look at the image, and take a good amount of time to interpret before you diagnose. Know how much time you get per OSCE station. Try and not put off questions for later. So if there's something that you're not sure about, still try and answer it to the best of your ability, rather than think that you'll come back to it, because you might not have that time and you might forget as well. And most importantly, I would say just relax and take it easy. This is not an MS exam or something like that where you need to read extensively just before your exam. What you've learned in your training and what you've learned in your work is going to be much more useful than what you read last minute. So of course, it's good to get an orientation from the point of view of an OSCE or from a viva and go through these things, but don't worry too much about it. And you already have a lot of knowledge that you've gained from your training, and that is what is going to be the most useful for you. So thank you.
Thank you so much, Tushar sir. I think that was another treasure trove of knowledge and information for those appearing for the cornea FICO exam. From the YO panel, I'd like to call upon Dr. Shraddha Surekha, ma'am. Ma'am, if you're there, can you also share your experience with the exam? How it went for you? What are your pointers and tips for taking the cornea FICO exam?
Hi, good evening, everybody. So I'm Dr. Shraddha. Am I audible?
Yes, ma'am, you are.
Yeah.
Yeah.
Okay. Firstly, thank you to TNOA and UC for inviting me to share my views. So I had given the FICO exam some time back, and what I am relieved, I was relieved actually to give it just kind of close to my fellowship. So one of the things that I would like to tell potential candidates is that while you're training, or just while you're ending the training, give the exam, because there's some things in the theory which you may not remember later on, and you'd rather get done with the FICO exam close to your fellowship, wherein you are reading a lot and some bits of theory also. Now, when I gave my theory exam in cornea in refractive surgery, I distinctly remember that there was I didn't clear one time the theory exam. And it was because there were a lot of numericals, like Dr. Neha also mentioned. So, if you're good with numericals and remembering those, it's fine. If you don't clear in that attempt, that's also okay. I mean, it's really your luck. The next time around, the same exam did not have those many numericals, and it were the questions were more practical oriented, which you could kind of answer even if you'd done your fellowship properly. You really didn't have to study too much to give the exam. The interesting bits were wherein they confuse, like they would confuse in any MCQ exam, wherein they would probably give you, say, something about fibrin glue, and then they would give you two options wherein you could get confused between two options. So again, you need to be careful when you are kind of reading up stuff and memorizing it, because those are the things which can get you through that exam. So don't make mistakes in those two options, like going back to your NEET PG preparation and those kind of preparations. Now, when we talk about the practical exams, the OSCE I thought was fairly okay. It was based mainly on what you had studied during your fellowship, what you did during your fellowship. So, I mean, most of the common instruments, most of the common diagnostics are covered during fellowship. And if you've done that well, I don't think you really need to be stressed. Even some of the clinical scenarios given are what you do in everyday life during your fellowship. Now, I wouldn't say that you would do that during your actual practice, because if you are, say, in private practice like me, you may not encounter those many situations of an exam level during your day-to-day practice. The thing which helped me during my Viva was going through the publications of the institute from which where I was going to give the exam at. So I gave the exam at Narayan Netralaya in Bangalore for refractive and cornea, and I went on PubMed and studied some of the recent publications. So that kind of got me in sync with what's the thought process of the examiners from there. What are the machines which are being used there, and like for Narayan Netralaya, they like their machines. So go through some of the recent machines. What I mean, you would want to know what would be the potential advantages of that machine versus the other machine. For say some place like AIMS, they are probably into studies more. So you would want to brush up more on the studies. So be practical about the place where you're going to give the exam at and the potential examiners, and read the publications of those institutes and the examiners. So the other thing is, if you fail in one of the theory exams, it's okay. It's just bad luck. Practical, I think, was if you've done your fellowship and all properly, you'll be able to get through with, I feel, without too much preparation. Probably the competition wasn't that high when I gave the exam, but it was pretty nice and very systematically held. So Anujit, back to you. Thank you.
Thank you so much, ma'am, especially sharing your practical experience as well as the theory exam and the variability in the theory exam questions. Like you mentioned, the first time it was more about the numerical questions, and the second time there wasn't so much emphasis. I think this is a very good point for those taking the exams to remember the pattern in which it has been trending for a while, even though the new 2020 guidelines are out for everyone to go through.
Right.
Thank you so much. With that, I'd like to go back to this SO panel and invite Dr. Nirupama ma'am also to share her tips for any exam goers that she has.
Yeah, good evening, everybody. So actually, I would like to inform the young ophthalmologists who are going to give their FAICU exam that, as Dr. Grover had mentioned, it's an excellent platform which brings about a uniformity in the standards of subspecialty training in India. So once you complete your fellowship, you feel you are at par with other fellows who have also completed their training from premier institutes of the country. And I had given my exam 10 years ago when I felt the theory exam level was slightly more difficult and the pass percentage was less. Maybe now, because of increasing the number of questions, maybe the pass percentage is slightly more. And it actually gives an overall completion to the fellowship course, because there are so many fellowship programs which don't have an exit exam. So at the end of the fellowship, you may be still feeling a little incomplete. And once you give the FAICU exam and you pass it, you definitely feel that you have achieved a completion. So that will be another useful reason why you have to give the exam. and it will actually improve your moral boost also. So that once you start your practice in the subspecialty, you feel more confident, and you can make decisions more confidently when you treat patients. And I had done my exam at RP Center, AIMS, and my examiner was Dr. Pradeep Sharma. So at that time, it was actually an excellent opportunity for me to meet doyens in this subspecialty. So I feel as students, we get to meet and interact with experts, and that also gives a little more better feeling at the end of the exam. I think similar experience was shared by Dr. Loganathan also when he had given the exam under Dr. Grover. And many students feel that this exam can be given only after completion of fellowship. But now I'm encouraging all my senior residents that during their senior residency, if they have a particular interest in any subspecialty, so they can read up standard textbooks and other resource materials, and take guidance from consults, and then vision. The senior residency, they can give this exam and they can continue to practice in that subspecialty. So these were my thoughts, which I would like to share. Thank you.
Thank you so much, ma'am, especially highlighting the fact that you get to meet a lot of doyens in the field, which sir also highlighted. With that, we move on to the next talk. I will just share my screen once more for the audience. Next, I would like to call Dr. Shreyas Jain, sir. He has a degree in FRC from the Royal College of Ophthalmologists and FRCS Glasgow, an FAICO and ICO in vitreoretina from the All India Ophthalmic Society, and an FICO. He has completed his MD from the RP Center in 2015. With that, sir, I'd like to invite you to the webinar and invite you to share your screen. Just a minute, yes. I would
for nice introduction.
I think with your experience in numerous international exams as well, you can provide a very good umbrella of knowledge for those appearing the FAICO.
My screen is visible now?
Yes, sir, it needs to be. Yes, fully visible.
Good evening, everyone. I'm Dr. Shreyas Jain. I would like to thank Tamil Nadu Ophthalmic Association for giving me the opportunity to talk on FAICO examination. Today, I will be giving some tips which helped me during my examination in FICO UVA. First of all, we should be clear why we want to give this examination, because without this examination helps to test your knowledge. It enhances your knowledge, which in turn helps you to gain confidence in your subspecialty. And moreover, it helps you to get the specialty certificate, which most of us don't get after training from the institution, where the certificate will help a lot in future, because it is given by one of the largest ophthalmic society and the largest ophthalmic society of India, which is AIS. So when to start preparing for this examination? I think we should start prepare it for the first day of the fellowship. We should not miss any opportunity to make any presentation or any write paper, because during preparation of those presentations or papers, we do a thorough literature review and we read a topic in very detail. Now, coming to the important books, the most important books are the Kansky and the AAO series on uveitis and ocular inflammation. The Kansky have very good pictures of all the pathologies, and it helps a great in the OSCE examination, because most of the OSCE are the image-based examination, and uveitis series of AAO helps a lot for the theory examination, because all the topics are covered in very detail. And at the end of the book, there are few MCQ questions which can help you in theory examination also. And as mentioned earlier also, this book is very helpful to clear theory examination, not in FICO, in other exams also. This book has some specialty based MCQs. Now, coming to the reference book, these two books are considered written by the Foster. Every topic given in very detail, so we can't read it in full. But in case of any doubt or any debatable topics, we can refer to these two books. In the today era of the social media, these two sources can help us a lot. And it is a 1 hour long lecture which covered a lot of topics in detail to clear the OSCE examination. And in the ONE network, there are a lot of subspecialty based MCQs given, which we can go through before the theory examination. Now, coming to the topics which we should go before the examination, I think in the practical examination, a lot more depends on the pattern depends a lot more on the center of your examination. Like this year, because the center is in the PGI Chandigarh, so everyone must be aware about the ocular tuberculosis, because PGI Chandigarh has done a lot of research on this topic, and this review article everyone must go through, because PGI Chandigarh was one of the main center for this study, and everyone should know about the current diagnostic criteria and management of ocular tuberculosis. Another important topic is white dot syndromes. I clearly remember that in my examination, out of 10 OSCE stations, I got 2 or 3 stations on white dot syndromes. And to read this topic in detail, one can easily go through this table. And this table is given in WO series. And one can easily go through this table in detail in a very short period of time. Now, another important topic is the difference between the acute retinal necrosis and the CMV retinitis. So this this is given very in detail in the iWiki and nicely described by Dr. Kaushik Tripathi, the difference between the CMV retinitis and the ARN, because these two are very similarly looking. And in OSCE or Viva, they may show you the pictures, and one can easily confuse between the two disease entities. But the pattern is entirely different, and the treatment part is also very different. Because in CMV retinitis occurs in the immunocompromised, while the acute retinal necrosis occurs mostly in the immunocompetent patients. CMV retinitis involves the posterior pole of the disease, while the ARN involves the peripheral retina. And the treatment is for CMV, it is the valganciclovir, while in the ARN, it is treated with the acyclovir or the valcyclovir. Now, the trials are very important in uveitis, because these are very few in comparison to the retina counterpart. And we should aware about the major trials like Huron study. It evaluated the dexamethasone implant in the uveitis. In MUST trial, they evaluated the difference between the furosemide implant, which is known as the Retisert, versus IVTA and immunosuppressant. And adalimumab is very important trial, because in today era we treat a lot of patients on the adalimumab. So visual 1 to 3 are very important. And MERIT trial compared the safety and efficacy of the ranibizumab versus Orthodex versus methotrexate. Masquerade syndromes are very important, because you can easily get one station on masquerade syndrome. Even in my OSCE examination, I got one case scenario. The case scenario was given along with the fundus photo and OCT picture of CNS lymphoma. So it is very important topic to read. And in the today era of the biologics, the immunomodulators and the biologicals are very important to read about. Recently, I talked to one of my colleagues who told me that in the theory exam, a lot of questions were asked about the various immunomodulators or biologicals and their specific targets. So these are must to go through before any examination. Now, coming to the another important topics include in the anterior uveitis, it is the HLA-B27 uveitis, Fuchs, and juvenile idiopathic arthritis. One should be aware about the screening criteria of the juvenile idiopathic arthritis. In the intermediate uveitis, one should know about the multiple sclerosis, sarcoidosis, pars planitis. And posterior uveitis is very important because lot of more pictures or OCT, FFA you will get from the posterior uveitis only. So you must read about the VKS syndrome, Behçet's disease, sarcoidosis. Syphilis is a very important latest topic for the examiners. And one of my colleague got the neuroretinitis case in his OSCE and Viva examination. So at the end, I would say that please don't panic in this examination because these are just the additional examination, not the exit examination. And you should enjoy because we never fail in this examination. Either we pass or we learn. So please don't panic in this examination. Thank you.
Thank you, Dr. Shreyans. Is there any degree that you have not completed in ophthalmology? Just curious.
Thank you.
Yeah, thank you for enlightening talk on FAICO UVA. And any questions from our co-chair, Dr. Loganathan sir, or your comments on Dr. Shreyan's talk, or any of the SO panel or U panel? Loganathan sir, over to you, sir.
You rightly mentioned that he has given all the exam which is available across the country as well as
Yes,
abroad.
sir.
So thank you for sharing that nice introduction. And generally, UVA is just want to add, being in a teaching institution, it's more of knowing the systemic disease, when, especially in ophthalmology, when you're dealing with uveitis. So the examiner who may be interested in, especially in Viva, and how to work up the uveitis is more important than just diagnosing the ocular conditions. So it is more of both knowing the systemic disease and its complications, and especially like masquerade syndrome. So unless we evaluate, even with all the available investigations, like which one need to evaluate the next step by step approach, like you already pointed out some of the reference books, and usually we read it in the second year when you're doing our MS. So any case presentation or any seminar, even during the fellowship, so you have to refer all the available books as well as the up-to-date journals. So that will give easy to go through all these exams. And I rightly pointed out, don't panic, like it's an additional exam and additional recognition for the work you have done for the fellowship program, actually.
Thank you. Yeah, Anujit, if there is any comments from any SO panel or U panel for Dr. Shreyans? Yeah, Anujit, will thank you, Dr. Shreyans, once again for this enlightening talk. And I think the catching point was all your degrees. I think it's very inspiring too. Thank you once again. So we'll move to the next speaker, a good friend of mine, Dr. Reenal Pandit. So Dr. Reenal, she's a board certified glaucoma surgeon, has completed her long-term clinical glaucoma fellowship at the Shankara Nethralaya MRF, one of the most prestigious tertiary eye care institutes in India, where she has gained extensive exposure to various glaucoma subtypes and management modalities. She currently works at the Choitram Nethralaya Indore, where she provides comprehensive diagnosis and treatment of glaucoma patients using advanced ophthalmic imaging and surgical techniques. And she also runs a good Instagram channel as well, which is very succinct, like a flash notes. Over to you, Dr. Reenal, for the next few minutes.
Thank you for your kind words, Dr. Prasanna. Well, good evening, one and all. Thank you, your task force, for having me on board today for this very unique and one of its kind webinar. So today I'll be sharing few tricks to help you crack your glaucoma FAICO practical exam. So talking about my own experience, 3 years back when I decided to appear for this exam, just before the exam, I looked up at the official website and maybe just called a few of my seniors to ask and understand about the format. However, nothing came out very clear and I ended up being as confused as this gentleman here. Well, somehow I cleared my exam, and ever since I have passed the exam, I have been getting multiple calls from many of my friends with similar queries. So I feel the confusion somewhere still persists. And so let's clear all the confusion once and for all. So, in my opinion, rather than hunting for recall questions or finding some particular format or any guideline, your preparation can be much more focused and well organized if you understand what is the exam format and next, what exactly is being evaluated here. So since we are already done with the theory exam and we are talking about the practical exam here, the practical exam format is very simple. It has two steps. The first is the OSCE and next is the Viva. Now this OSCE will typically have 10 questions. Each questions can have multiple sub-questions. Now these questions could be anything ranging from a clinical case scenario, a surgical complication, questions pertaining to a particular clinical trial, or maybe an MIGS device. It could be just anything under the sky. So it's very difficult to predict. But in my opinion, all these questions during my exam were not very complicated. They were well structured and we have enough time to solve all of them. So once we are done with the OSCE, next is the Viva. Now, when I appeared for the exam, there were 2 stations, but recently I got an input that they have changed it to 4 stations. So basically going to face 4 different examiners. I would rather say glaucomatologists. So you better be well prepared. Now, if you ask me how to prepare for the exam, first I would like to you to understand that what this exam is basically evaluating. This exam is not just looking at your theoretical or basic knowledge in glaucoma, but there is much more to it. Basically, it is structured in a way to directly or indirectly analyze your clinical judgment, skills, reasoning, and the problem-solving attitude. The main aim of this exam is to qualify you for dealing with not just simple but complex glaucoma cases in your day-to-day clinical practice. So having understood that, let's know something about the exam preps. So all of you have already cleared your theory exams and all you need is just a very quick revision of the subject. And I would personally recommend you to watch these eye focus glaucoma modules available online on YouTube. I recommend these videos is because of 2 reasons. Number one, the content given here is very much recent, updated, and it almost covers the entire subject. And number 2, these speakers are the prominent glaucoma specialists across the country and definitely are going to find 1 or 2 of them as examiners in your exam. So do watch these videos. Now, after having done a quick revision of the subject, I would want you to pay special attention on few of the topics. Number 1 is MIGS. Now, this MIGS is currently the most hot topic and the most favorite amongst the glaucoma specialists in India. It's being widely practiced in India. And I would suggest you to have information regarding not just the mixed devices available in India, but also all the mixed devices available globally. Now, this particular article from iWiki is my personal favorite because it has a very good information about all the mixed devices. Not just ones available in India, but also available across the world. So you can refer this for your mixed revision. Next are the clinical trials. Now, all of us have read the landmark clinical trials in glaucoma like the CIGTS, TVT, VES, and we have read them all over our post-graduation curriculum. But there have been a lot more recent, or I can say relatively recent trials in the field of glaucoma like the EAGLE, SALT, ZAP, LIGHT. And I think you're more likely to get questions from a few of these recent trials. And just in case you've not read about them, I would recommend go back and update yourself. Next is all about the recent advances. Well, just like any other field in ophthalmology, lot of research and lot of recent advances are coming in the field of glaucoma also. A lot of new therapeutics being introduced, just to name a few like the iDose TR, the Amycleopard, Durista, Vyzulta. A lot of research is being done in the field of ocular blood flow, genetics, neuroprotection, etc. And what I would suggest is you have a decent amount of knowledge about the recent advances. Coming on to the investigations, now this particular segment is very, very important because you're certainly going to get questions from investigations in your OSCE as well as at one of the stations. Now, one important thing to note here is that you are going to go to a center for your practical exam, which is going to be a state-of-the-art center, and thus it is going to have all the investigations and all the imaging modalities in glaucoma. And thus, if at say your center you are just doing the Humphrey perimeter, that doesn't mean that you might not be asked an octopus printout. So do read about all the available perimeters, all the tonometers, all the gonio lenses, especially the intraoperative gonioscopy lenses, all the OCT modules, especially the ASOCT and the OCT angiography. Do read about UBM and ocular blood flow studies also. Now, this is a relatively newer segment which has been added up, the surgical videos and instruments. So what they do is basically show you a surgical video, stop somewhere in between, and they might ask you that which step is going to follow next, or something like they'll show you a trabeculectomy video and ask you to tell where exactly you would like to place the ostium. So something similar to this. So do browse your YouTube for all the surgical videos, TRAB, angle surgeries, MIGS, valves, and few of the complication management surgeries like choroidal drainage and cleft repair. Lastly, OSCE practice. Why I'm telling this is because a lot of us might not be very familiar with the OSCE system of exam. In fact, if I talk about myself, I came across this OSCE questions for the first time during my FISU exam. So it's always a good idea to practice before you go for the exam. And again, I am more of a digital person, so I like watching videos on YouTube. Again, you have videos from iFocus on the OSCE, and you can also go back and read any of the AO network books for practicing your OSCE. So, concluding my talk, I would like to say that definitely we need to study very smartly for this exam. Of course, we have been studying hard all these years, but for this particular exam, I would say that it is time to study very smartly. So thank you for watching, and I wish all the exam goers good luck. Thank you.
Thank you, Dr. Reenal. I definitely do resonate with you on the smarter part. 5 years back in 2019, I took my glaucoma FAICO. We were able to identify the parts like an harm's trabeculotome or a goniotomy, or the visual fields we had. Sound noise ratio was 2/10, and the questions were then starting to lead whether it's a reliable field or not. But I think we need to be prepared to what we are going to see, so that the subsequent questions are the slightly theoretical part. Once the 1 or 2 questions with practice we are able to identify, but then going down forward, we need to know some amount of theory to really understand or get it through for all the 3 or 4 questions. And I think we do have Dr. Mainak. He was my colleague in the FAICO glaucoma exam. Dr. Mainak, are you there? Yeah, so me and Dr. Mainak. Yeah, yes,
Hello?
Mainak.
Yeah. Yeah.
Yes, Mainak.
Yeah.
Your take
Hi,
on.
Dr. Prasanna.
Yes, yes.
Yes, yes. So thank you, Dr. Prasanna, TNON, and Dr. Anujit for having me here. So I think that was pretty comprehensive what Dr. Reenal has already covered on the preparation for FAIC of glaucoma. Uh, my personal take would be that uh, I had appeared for it twice actually. In the initial attempt, the theory I uh, couldn't clear by a very narrow margin. So I felt that the theory part, post after clearing the exam, like she said, you're approached by your juniors and the fellows in the coming years, and that is a very common practice of as about how to go about the preparation for it. So I personally tell that there is no standard text for it. Like you have to have a very comprehensive preparation, whichever book you can revise in a short span of time. Because if you're into practice, if you are already a fellow or a senior resident, probably you can find a bit more time for it. But otherwise, you have to revise it supposedly in span of 2 to 3 months in that time. So whatever book you're comfortable with, which you can browse from end to end, so that is a better option. And because I think there are a lot of factual questions which go very detailed, which are not like superficial. You have to go for a very detailed reading for that. There are some questions which are purely clinical, which are like based upon what is the best practice in a particular clinical situation. And there are some questions which are based on studies and the newer devices and the newer drugs, which are like inherent to all the specialities, but particularly to glaucoma. So, and as about the OSCE exam, I felt that the OSCE exam, the practical exam, was relatively if you are very well versed with your subspecialty, it does not need too much of a separate preparation as such. The OSCE was very comprehensive in our time, like Dr. Prasanna said, that we had appeared for it together, and it was quite a great experience, I would say, that because we had our exam at one of the most premier centers, and it was very comprehensive. There were like all the stations had like there were
All
2 to 3 clinical yeah. So they had clinical scenarios and clinical patients, and they had very extensive questionnaire based on that. And for the Viva, again, it depends. It is a bit subjective as to like how in which direction it is going. But I remember since Dr. Dada was our examiner, and sir is a very encouraging mentor. Like he told me at the end of the like my Viva that you don't have to appear so gloomy. Nobody answers all the questions in an interview or a Viva. So I think kind of uh, that sums it up that you have to be very thorough about your preparation for the theory part. For practical, it is a day-to-day learning. It is not just a like you don't have to prepare it in some span of days. If you are very thorough with your subspecialty, you will go through it. So that's my take on it.
Yeah, and as one of the previous speakers pointed out, I think 5 years back in 2019, it was a very surreal feeling to have Tanuj Dada sir and Mona Kurana ma'am as our examiners in SN MRF. So I think that was again, we never expected.
Absolutely.
I totally resonate even with Dr. Loganathan sir who was talking that AK sir was his examiner. I think that was the first time we were able to. It was two different emotions. We were like happy that we are meeting them, but again, then we were slightly anxious that they are our examiners. But all's well ends well. Another point I just wanted to add during the preparation, it was slightly pre-COVID at that time, where now I think the data are much more. I saw iFocus is really coming up with a lot of great OSCE patterns. I felt Iowa videos, the 50 Iowa videos was also quite helpful during practical preparation, more of image based as well as it really helped mine where I remember quickly revising those videos which gave me a more it was more like revising your clinical acumen at the end of the day. But I think that is something that I feel still it really helps the neophytes. Thank you, Dr. Reenal. Thank you, Dr. Mainak. And any other discussions from the SO panel, Loganathan sir?
Just I want to add, being in a digital world, like when you check for any information for the youngster, just to verify the originality and the standard.
Yes, sir.
Question for the Dr. Rinal. So what is the single point to decide to take the Faico exam for the benefit of the people?
Pardon, sir, I didn't get your question.
So why just to, after completing degree from the Premier Institute, why
Yes.
you have decided to take the Faico exam for benefit of the future fellows?
Yeah, so mainly at SN we didn't have an exit exam. So just for a sake of completion, as madam said earlier, I just for that sake of completion, I felt that it's better to appear for this exam. So I did appear for this exam, not immediately after the fellowship, because it was already very tiring. The 18 months of fellowship, but almost after a year and a half, I realized that why not like just revise the entire subject again, maybe just for a sense of completion.
Thank you.
Thank you.
Thank you, Dr. Reenal. Dr. Shweta, do you want to add something more on this? Shweta has also cleared her glaucoma Faico quite recently, I suppose.
Thank you, Dr. Prasanna. I've cleared my Faico examinations into 2021. I think Dr. Rinal and Dr. Prasanna and Mainak has actually covered up everything. A few things that I would like to add, of course, the Iowa curriculum really helped me in preparing my theory examination. It was suggested to me by Dr. Prasanna itself. And because at that time when I was going to write the fellowship, I didn't have anybody to guide me. Like from internet, we do not get anything like what we have. These talks really, it's going to help the future generations. So Prasanna was the one who was actually guiding me through the FICO, and AO's curriculum really helped me. And the basic science clinical course text that we have in glaucoma, even that was really helpful. So you just go through the text, and then if you listen to the videos from the IO curriculum, they have beautiful videos and photos. So it's kind of easy for us to memorize and have a quick revision too. And then talking about MCQs, the one network in the AAO that has also helped. Almost it is the questions were little similar to what we have in the examinations, and you have to go little thorough with the preparation part, because the MCQs that you have, you can have two answers which will look which we may be confusing which is the answer. So only if we are thorough in knowledge, it will help us. Now coming to OSCE and Viva, I had my center at RP Center Ames, and OSCE, as everyone has pointed out here, it was purely basics. I had questions on one tonometry, gonioscopy, the OCT, which was mainly the Heidelberg with the GCL. Then fields, it was the HFA 32-2C program, then some clinical, medical, surgical, and question on MIGS. So it covers almost everything. Now coming to the Viva, if you know your examiners, it will be more useful. Like you are expecting where you're going, and just go through whatever studies they have done. For example, mine was Dr. Tanuj Dada sir. So he was also asking me about the meditation and glaucoma effects. So questions like that, you can be prepared. And it's mainly go through the studies, the recent, whatever you have, the MIGS, the recent drug delivery systems. And you needn't be scared, because if you give the exam closer to your fellowship, you'll be able to crack it more easily. And it'll be a feel-good factor once you get through all these examinations. Thank you.
Thank you, Dr. Sridhar. Anujit, shall we move towards to the next speaker online?
Yes, absolutely. Zain sir is next. I'm just sharing the screen.
Nishant sir, you can
Nishant sir,
with the next speaker. Yeah.
Yeah. Hello. Good evening.
Yes, sir.
So I'd like to introduce Dr. Zain Khatib, who's a consultant ophthalmologist at Khatib Eye Clinic and Perfect Vision Laser Center at Mumbai. So he's an expert in cataract surgery, LASIK, refractive surgery, and glaucoma as such. MBBS from the prestigious Seth GS Medical College and KEM Mumbai. Finished his masters in Karnataka institutes. The other degrees is apart from DNB, FICO, MRCS, FAICO, and FICO refractive surgery. And Dr. Zain is going to talk to us about cornea and refractive. Over to you, Dr. Zain.
Thank you, Dr. Nishant. Can I share my screen?
yes, sir, absolutely.
Yeah.
Yeah, so just a small correction. I'll be speaking on cataract and refractive, not cornea. But yeah, that's okay. Most people tend to forget cataract. Cataract is not given that much importance as a separate subspecialty in our country. But credit to AIOS, they've given a separate FICO exam for cataract. And honestly, I feel cataract as a specialty, it's high time it's given its due. It is a separate subspecialty of ophthalmology. And the FICO exam itself proves it, because it's an exam which is, not easy to clear. It's one of the most difficult FICO exams. So I would just like to share a few tips, related to what I feel can be helpful. As far as books are concerned, uh, it's really difficult to say which books to read. I don't think that really makes a lot of sense, because if you are working in the field, as an expert, whether it's a fellow or whether you're a consultant, you need to gather information from everywhere, be it conferences, be it publications, be it books. So, I'll speak more about what I feel, what topics are important in terms of the exam rather than from where to get the resource materials, because resource materials are available everywhere. I'll speak about cataract first, and then I'll briefly talk about refractive surgery. Okay, so generally in Faico, the practical exam part, I feel, it's an OSCE game. If you're good in your OSCEs, you've identified 7 to 8 out of 10 of those OSCEs correctly. I really think the Viva shouldn't be difficult. So if you're working in the field, the Viva just becomes like a discussion. But OSCEs, there are some pointers I would like to give. You really need to be relaxed and sharp minded because you have a short period of time to identify it correctly. And if you identify wrong, no point writing the rest of the thing. So, you have to be relaxed. You need to sleep well before the exam. I would say you need to have rough or extra papers handy for the OSCE because, many times you may not want to write the final answer. And when you've got time in your next spot, which you finished early, you can kind of go back and write the old one. Don't write long essays and all. No one really cares about it. You just need to write point wise. The examiners just want to know whether you've identified and know how to whatever treat the thing. Many times photos are really ambiguous or unclear. Okay, so when we are examining patients ourselves, we see with our eyes, but the photos and all which we are shown in OSCEs are many times ambiguous. They are pixelated. So I would say use your questions also to give clues to what the photo may show you. And don't overthink always. Mostly it's the most obvious answer which is right. Because I remember in my refractive exam, I had a OSCE showing a photo of epithelial ingrowth, and I just didn't write it as epithelial ingrowth and wrote it as something else because there was already another OSCE before on epithelial ingrowth. So I thought, why will they ask the same thing twice? But actually, there were two on epithelial ingrowths, and the fellows are the ones who prepare the exam, so they didn't have anything else. They must have put two epithelial ingrowths. So don't overthink. You should see what is the most obvious answer. That would be right. So when coming to cataract part, I would, in order of preference, like to just share what I feel topics are important in terms of knowing for the FICO exam. More so for practicals, not so much for theory. Theory, you just it's very theoretical. You need to know everything of the subspecialty actually. But in terms of practicals and OSCE, I would say the most important are your diagnostics. Maximum questions and all come on this, and the biometry is most important. So you have to know different optical biometers, their working principles, their functions, all the modern formulae. What are their principles? IOL power calculation and post refractive eyes. All the online calculators, you need to know this very well. Barrett True K, Barrett TK, Evo, Kane, all the keratoconus formulae, how they function. This is must know for FICO exam. Okay, if you don't know this, then it's really not okay. Aberrometry is another very favorite topic. Even to keep as a spotter. So eye trace is most common as a aberrometry report which you get, and the NIDEC OPD scan 3 is less popular, but eye trace is very popular, and people like to ask questions on what eye trace shows. Topography, tomography, not so important from cataract point of view, more for refractive, but they can show a spot of topography as well. So this is how an eye trace report looks like. They can just show a spot like this and ask you to comment. It may not even be related to cataract, but what the spot shows, you have to identify that this is an eye trace report, and it shows that the internal astigmatism and corneal astigmatism are in opposite directions. Blue and red. So the total astigmatism is much lesser. So things like this, you should be able to understand. You should be well versed with this. After diagnostics, the second important topic I would say is phaco-dynamics. Okay, understanding all your different phaco pump mechanisms, venturi, peristaltic, newer pumps. You should know all that. You should know very well your phaco tip designs. What is a flare tip, Kelman tip, microflow tip, easy tip, balance tip, all this you need to know well. Okay, you need to understand and know fluidics, what is panel vacuum, linear vacuum, concepts of flow rate, all surge mechanisms, what machines use, what surge prevention mechanisms, all these need to be known. Phaco power modulations, you need to know these terms very well. Micropulse, hyperpulse, torsional, longitudinal, elliptical, which machine has elliptical, which machine has longitudinal, this all also you need to know well. Even historical features, some things that are not there now but were used in older machines is something that is desirable to know. Phaco-dynamics, in I would give it as a second number in the FICO exam. you can be shown a spot like this. So the top one is a Kellman bend tip, and the other one is a balance tip. So you need to be able to identify which machine has these tips. The third part would be IOL related. You need to understand the concept of monofocal, which monofocals have how much asphericity. You need to understand diffractive optics, how trifocals are better than bifocals in terms of orders of diffraction. Very favorite question is, EDOF lenses and their principles. That is what is something that you need to know today. Toric IOLs, again, something very favorite thing to ask. You need to understand your online calculators. You need to understand concepts of posterior corneal astigmatism, surgically induced astigmatism, the recent papers. What is the concept of centroid? All these things, you will get from recent publications and attending these conferences. Again, the marker list systems also for toric IOLs are very important. You need to be able to identify your instruments and have know their functioning with names. So chopper names like Nagahara, Seabell, Chang, Malugin ring, D-hex ring, iris hooks, capsule hooks, CT segments, how they look and their names. All this needs to be known. So this is a photo of a capsule tension hook. This can be shown. You can be shown a chopper like this. Okay, so this is basically a Chang chopper, which has on one end a blunt chopper, which is the Nagahara type, and the other end a kind of a spatula chopper, which is the Seabell type. So this is how a Chang chopper looks like. These things can be spotters for the exam. Fifth would be theory topics, your subluxated cataracts, all the syndromes, Marfan's and Weil-Marchesani syndrome, your congenital cataracts, drug-induced cataracts, pediatric cataracts, all these things theory-wise you need to know. They can also be spotters. Complications, all your cataract complications, this one is easy. I mean, you should know how to identify. You can have a photo like this. It will show you, this is a posterior lenticonus. They can ask questions on this. And this is a photo of, a striate keratopathy post-op. So, these were some of my, what I feel are important to know for the Faico cataract practical exam. Since I have to cover refractive also, I've just kept one slide on refractive. So tomorrow is the practical exam for refractive surgery in Narayan Nethralaya, and this year 27 students have cleared theory. So clearly, people know what to read for theory. Practical, if it is in a center like NN, which is quite common, they have very specific things they ask. They'll show you a pentacam map with one of these, either early keratoconus, ectasia, advanced keratoconus, TMD. These all have typical topographies, and you should be able to identify and answer all the questions. Contact lenses, again, very favorite. They'll show one or two contact lenses as spots, either RGP, scleral, rose K lens, and they'll ask questions related to that. Again, if the exam is in AIMS, contact lens becomes very important. So you have to read maximum, on contact lens and how they look like. You should be able to identify. This is something, again, which is very, very commonly asked. The complication photos, epithelial ingrowth, DLK, you should be able to identify CTK, opaque bubble layer, post PRK haze. Questions come on this. They can show you instruments related to LASIK, like a hockey stick knife. There are a lot of old instruments that were used for epithelial removal. That also you should be able to identify, smile dissectors and things like that. Newer technologies, refractive surgery is something you need to be well versed with. You need to know what are the different lenticule platforms, because that is what is upcoming in refractive surgery. Epithelial maps can be shown today because that is, again, has a lot of importance. And your biomechanics, Corvus maps also can be shown to you. So I would say for practical OSCE part, it will be something related to one of these 5 categories. Just to show you one last slide, they can give you an ambiguous photo like this and tell you to identify. So it's difficult to understand what this photo shows, but if you see the questions, they'll ask what pre-op workup is needed, what are the potential complications, and you understand that this is some procedure related. And if you see carefully, you can see a brown color shadow between the lens and the cornea, and that is a phakic lens, that is ICL, which is in the eye. So just wanted to show you that sometimes you may not be able to identify. The photo doesn't look very descriptive, but see the questions and try to identify what the spotter is showing you. You've got that, short period of time, so you should, utilize it properly. So that's about it. These last 5 photos are basically different complications related to refractive surgery. These all you need to identify very well. The top left is epithelial ingrowth. The lower left is something called as PISC, which is fluid in the interface when there's a high pressure-induced stromal keratopathy. The central lower one is again something very classic, CTK, very favorite question of Narayan Nethralaya. They'll show this and you should be able to identify. And DLK is the lower right, again something which is that you should be able to identify, the sands of Sahara that you can see. So these photos are very commonly shown for the refractive exam. And once you identify them, the rest of the questions should be easy. So that's it. Thank you so much for having me.
Thank you so much, sir. I think that was more than extensive. You've covered two major hard-hitting topics in a very short time. Very informative. With that, I'd like to go on to the YO panel once and to Shruti ma'am, who's also taken the Faico cataract FAICO. Ma'am, what has been your experience on exam day, questions that you would like to share, tips and tricks, if you will?
Yeah, thanks, Anujit. Yeah, I kind of took the exam in 2020. So it was in the COVID era and it was completely different from what's happening right now. So I think Dr. Zain actually covered it very extensively, and it's pretty much the OSCE stuff is very important. As we said, first look at the picture, and sometimes we are baffled as to what it is, but just take a look at the questions and you're going to get it. And most often than not, it's all very practical than what we are seeing every day in our clinics. So almost if you start paying attention from day one, for each and every patient, from biometry, from your patient selection, from your validation, and your Faico also, like for SICS and Faico, they ask you simple questions like, what steps do you do in SICS? What's your surgical protocol? So what machine do you have in your institute? And, how do you select patients for this IOL? So, and I think one of their favorite questions is, how do you dilute epinephrine? How do you dilute triamcinolone? Because I think we all use it very commonly, but we never think about it because the sister just handles it to us and we don't even bother to check what is happening. So, and autoclaving procedures for needed for your cataract sets. So they ask if they have flash autoclaves and what instruments do you do flash autoclaves for. So mostly what I felt with the exam was it was very practical, and we didn't have much of cases because of COVID. I think we just had 2 patients, and remaining all were like just based on OSCE. And the Viva was most on what do you do in your day-to-day practice. So if we focus on that from your fellowship from day one, and that's just going to get it through. Yeah. Thank you.
Thank you so much, ma'am. So we'll move on to the next speaker. Dr. Gunjan ma'am has requested to speak next. So I'll just go ahead and introduce madam. Dr. Gunjan Saluja is a consultant in Chhattisgarh, and a specialty is strabismus, oculoplasty, and neuro-ophthalmology. She has done her MD from the RP Center AIMS, followed by 3-year super specialization in strabismus, neuro-ophthalmology, and oculoplasty from AIMS Delhi as well as numerous publications in national and international peer-reviewed journals, as well as presenting in national and international forums. She has 12 awards to her credit, which includes the International Ophthalmologist Award by the AAO, as well as Best Outgoing Senior Resident Award at the RT Center AIMS. Ma'am, are you live with us right now?
Yes, I am very much here, Amarjeet. I would like if you can share the video presentation which I had sent.
Yes, surely. So I will share your video presentation. Prasanna sir, if you're there, can you just make sure that the audio.
Yes, Anujit. You can play it.
Very good evening, everyone. So I've been given this topic to discuss about clearing FAICO, pediatric ophthalmology, and strabismus exams. So first of all, why are you giving FAICO exams? I gave it because I believe that it was just like a fellowship exit exam, and it helped me to self-evaluate myself at the end of my fellowship. It enhances confidence in one, definitely adds a qualification, and I always believe that either you pass an exam or you gain some experience out of it. If you look carefully, most of us will be asking what you'll be asked. So ideally the question should be what one should know. So what you should know, that would be asked. And there's a very good curriculum which has been issued by AIOS that clearly states that a pediatric ophthalmology fellow should be able to perform comprehensive evaluation of the child with eye problems. They should be able to surgically manage childhood cataracts, strabismus, nystagmus, and lacrimal problems. They should be able to perform surgeries of eye emergencies in children, and they should be able to diagnose children with inherited pathologies. And they should be well versed in performing pediatric refraction. And one should definitely be familiar with the latest developments in the branch, as well as one should be able to perform community level screening of common childhood diseases, including ROP. And this is the basic spectrum of all the diseases which are usually asked in these pediatric ophthalmology and strabismus FAICO exams. So there are two parts of the exam. When I gave it, there were two parts. Part one was mainly multiple choice questions, and I hope all the fellows who are attending this webinar might have successfully competed in the part one of their exam. The important thing to note is that the passing grades in part one itself are a bit low. The probable cause might be because of the eligibility percentage for passing being higher. Questions that are usually asked in exams check your basic as well as theoretical knowledge. And as far as I remember, my question paper had questions about the embryology, retinopathy of prematurity, the screening protocols, the inheritance pattern of various diseases, strabismus basics, as well as some of the complex strabismus cases, as well as there were a few questions about the recent advances too. Now, the part two of your exam, your experiences and questions may vary according to the center. The center at which I gave my part two of the exam had a separate unit for strabismus, and my examiners had a very keen interest in strabismus, so I was not asked much about the pediatric ophthalmology. So your experiences might vary in that. There are two things. First is the OSCE and second is the Viva. So OSCE, you'll be given case scenarios. You'll be shown in the PowerPoint some of the case scenarios for which answers have to be given usually within 5 minutes. And be well versed at least with the common cases where you should not fall, like accommodative esotropia, sixth nerve palsy, fourth nerve palsy, DRS, intermittent divergent squint, their types and management, so Brown syndrome, to name a few. Viva was usually based on OSCEs, and examiners are usually very helpful. They asked, one question was asked about the recent advances also. So, like recent advances in the management of myopia. You might be asked that that's a very hot topic, no? So Viva is based on OSCE, and one should be very confident in answering each of them. Now, common question might be what to read, where to read. So for AO, subspecialty is more than enough for pediatric ophthalmology. And for strabismus, you can read any of these three books, like Von Noden, Rosenbaum, or Strabismus Simplified by Dr. Pradeep. Any of these three books would be, if you read completely, that would be more than enough to answer all the questions. So finally, this was when I received in 2020, I received my FAICO degree. It was special because I was the only one who was receiving the degree that year of pediatric ophthalmology and strabismus. So I'll be happy, more than happy to help. This is my email ID, and thank you for the opportunity.
Thank you so much, man. That was a very crisp presentation. Would you like to add something more while you are live?
Exactly. So I think as everyone else has also said that it's like a fellowship exit exam, and as I also mentioned, my center was at the center itself, so it was not very tough. I was quite familiar with the examiners also. But definitely, if you are going out, see, we as a pediatric ophthalmology subspecialty, we don't have much of machines to work on. So mainly you can be asked something about synaptophore or recent advances, what funds are going on. Like, see, no one is going to ask you about what amblyopia treatment study stated what. Okay, but you should know about the recent advances in myopia management including the orthokeratology, the DIMS lenses, the role of atropine, and various concentrations of atropine which are used. So I think it's yes, you gain an experience and one should give it. Thank you for the opportunity, Dr. Anujit and TNOA.
Thank you so much, ma'am. With that, we'll move on.
Dr. Preeti, you want to add any comments on that? Do we have Dr. Preeti, ma'am?
I think for oculoplasty, I think we can after the next.
Sure. Okay. Anujit, we'll move to the last speaker. Yeah. Yes.
So would you go ahead?
Yes. Yeah. Yes, Anujit. I would like the honor to invite my teacher as well, ma'am, Dr. Swati, ma'am. So she has 13 years of teaching experience as an undergraduate and as a postgraduate teacher. Apart from MS ophthalmology, ma'am is a gold medalist. She has obtained certification from FICO, DNB, and she is a member of the national and state chapters on Ophthalmological Society of AOS, TNOA, and POA. She is involved in various research projects and has research publications and patents too. She is interested in orbit and oculoplasty and also has certification for the same from AOS and ICO and has been an inspiration for students like me, Anujit, and more. Over to you, Swati ma'am, for the enlightening capsule talk on your specialty in FAICO.
Thank you. The screen is visible, no?
Yes, ma'am, and you're audible too.
Oh, thank you. I'm Dr. Swati from Mahatma Gandhi Medical College, and I have been asked to share my experiences regarding the FAICO oculoplastic examinations. I believe you have all successfully completed your theory exams online, and you are now awaiting your practicals within the next fortnight, where you will be facing OSCE and Viva. When I gave my exams, for OSCE, we had 10 stations and 5 minutes was allotted to each station to respond to the questions. OSCE stations included instruments, implants, where the instrument or the implant would be kept. You're naturally expected to identify it. And then you'd be asked questions. For example, if you had kept the Hurtle exophthalmometer, you'll be asked the principle. You're likely to be asked precautions that you take when you measure it, conditions where you're not supposed to use this instrument to measure, and then naturally questions on proptosis. Then, of course, is imaging. You're expected to identify the type of image, describe it, and then you would be asked a few questions, for example, either on diagnosis or on its management, which you will have to all write within 5 minutes. Then you have case scenarios. You could be kept clinical pictures with a short description of the case scenario, and then you'd be asked questions on it. Sometimes you'd be kept a case scenario with an imaging modality so that it helps you fine-tune your diagnosis, and then you'll be asked questions. For example, in the first picture, you could be asked questions regarding a contracted socket. With a lid tumor, you'll be asked how to not just the management of lid tumor, but also how to reconstruct the lid following this. Systemic association with certain oculoplastic and orbital diseases, etc. You will have a case which you'll have to examine like you did during your PG period, and you'll have to present this case during your Vivas. Your Viva includes case presentations, images, instruments, implants, and of course, depending on how you answer and what your examiner or your panel of experts want to know, the direction of Viva would vary. So you have some time given for your case presentation that you've already taken. The panel of experts who are your Viva examiners could have their own personal images, instruments, and devices and implants, and they could ask you questions on that. You're supposed to answer that. I did not clear my FAICO at the first go. So I believe I'm in a better position to tell you what did not work. Guesswork, atrocious ones, not supported by knowledge is a definite no-no. What helped is, of course, the textbooks that we've all read on the subject, use of multiple sources for the same topic, and online sources. All of you are members of AIOS. You will have access to one network. Through that, it is possible for you to access AIO's oculoplastic department. And there you are likely to come across a lot of OSCEs and MCQs, which I personally found very useful. Then there are a few other online areas where you may look at OSCEs, IDEL, eOfta, and iFocus, which gives you OSCE stations on YouTube. With this, I wish you all the very best for your examinations. Thank you.
Thank you so much, ma'am. I'll request Dr. Preeti to give her comments, who's also been the examiner of FAICO.
Hi, everybody. Good evening. And I think this is a wonderful meeting, wonderful concept of helping the students pass the exams. So I was one of the examiners for FICO. And what I would like to first tell you all is it's very, very easy to clear. It's not at all difficult unless you make big blunders. So when I had gone as an examiner, we had very simple questions. Like if we are giving there was one long case, 2 short cases, and about 8 OSCEs we had kept. And Viva, of course. So now in the OSCE, when we had kept a hurdles, we had kept a fracture patient's photo where the lateral rim was completely not in position. And we had just asked whether that instrument was appropriate for that situation. So that's the basic that we want to bring out from the students, is that when the lateral rim is not there, you can't use a hurdles, something like that. Even in the Viva, it's very basic. Like if I'm talking about a ptosis, I'm asking questions about ptosis. If you miss myasthenia, then it's a blunder. You cannot pass that exam. Okay. If you don't talk about frost suture or, basic eye movements. So we want only the basics, basic knowledge, so that we are sure that you will not harm the patient when you're in your clinic. That is our aim. So if you say you don't know and I will refer to a senior, then it's fine. But if you just insist, that what you're speaking is right and go on with that wrong talk, then it's a problem. Okay. So even when we were asking Vivas, we were giving situations to the students, like we drew a tumor on the eyelid and we said, how will you manage? It was, suppose I was describing a malignant tumor. So in that case, I want them to ask me what is the age of the patient, because depending on that, you're going to reconstruct whether the skin laxity is there. So what we want to know is whether you really have done or have seen something, because this is a certification that you are able to practice oculoplastics by yourself. So certain basic situations like eyelid tumors, chalazions, ptosis, entropions, ectropions, you should be able to decently manage. Then you clear the exam. We don't expect you to know advanced level of oculoplastics. Even fractures, basic fracture, which conditions you will treat, which you will not treat. You may not know how to manage fractures. That is okay. Okay. And if you're examining, if you don't know completely all the procedures for ptosis correction, it's fine. Basically, when you're doing a levator resection, you should know you are taking a frost. You are going to protect the cornea. You're going to check the cornea the next day. If the student knows all this, you pass. So that is the basic way in which you should even practice. And I feel CHUA is a good website, which we used to do for FRCS, because that gives you the basic points that you should know for each case, so that you don't miss that particular thing, at least for that case. It's a very good, we used to use that CHUA site for our FRCS clinical exams. And I am also an examiner for FRCS. So I feel the line of questioning is almost similar in practicals. There also the aim is you should not harm the patient. You should not miss a myasthenia and advise surgery. Things like that. Okay, but not like absolute details of every procedure we don't expect. We just want you to be oriented that age is important when you're reconstructing basic reconstruction procedures like a pentagon, direct suturing, utensils flap, lid sharing. If you name these also is enough. You don't need to know all the details of how the technique is. I think that's about it. If anybody has questions, I can help you with that.
Thank you. Thank you, Dr. Preeti.
Dr. Sindhuja, I think you have taken your.
Yeah, hi. I
Please.
hope you can hear me. So I took the exam in 2021, and as Preeti ma'am said, it's just basics. So if you know your basics, you can easily clear it. And especially for the practicals, it actually depends on which center you're giving. So I gave in LBPI, and just for an example, like they first gave me an instrument. So in the center where I work, we usually do ptosis correction mainly with sling procedures. So I have not seen the method to do with fascia lata, how to take the fascia lata graft. So the instrument was kept for that. So it was a little difficult for me to identify that, since in that center they are still doing that procedure. So I think you should know everything in detail about, such things, the basics, what all surgeries we do for everything. So that is one thing, for the people who are going for the practical exam to keep in mind, like in which center you're giving. So it will be helpful for you to know what all procedures as well they do there and everything related to that as well. Other than that, the examination is very, very easy. Basics is, if you're thorough with your basics, you can easily crack it. Yeah, that's it.
I'd like to give the mic to from our SO panel, Dr. Rajlakshmi ma'am, to just summarize her experience in the exams and any other tips she would have for those taking this exam.
Thank you, Dr. Arijit. First, I would like to thank the team TNOA and Young Ophthalmology team for giving me this opportunity. My namaste to my mentor, Dr. A.K. Grover sir, and my senior, Dr. Lognathan sir. I would first like to congratulate all the speakers for highlighting the points to be noted for all the exam going fellows. They have clearly mentioned in each of their specialities, what are the areas they need to concentrate on for their Viva, because everyone has cleared the theory, so they know about it. But for the OSCE and the Viva, what are the main points that they need to note, and what are the areas that they need to concentrate on? This has been clearly highlighted by all the speakers. I congratulate them all, and the team, Young Ophthalmology team, for organizing such a talk, because I honestly didn't realize that it'll turn out to be so helpful. Okay, so when I went for the exam, I did not have such a such an orientation to the exam. Okay, so the part 2 of the exam is basically your OSCE stations and your case presentation. And as clearly mentioned, in those 5 minutes, whatever station that has been kept, that has to be clearly identified, and the questions have to be answered very precisely. You don't have to write long answers and all. So make it crisp and brief to the point. And if you don't identify it, the entire thing goes, the station will be totally wiped off. You won't get any score for that. So you have to keep that in mind. And if you're not able to identify from the pictures, you can read the questions, take some clues somewhere to identify the right answer. And there will be some googly questions, which almost 80-90% of the fellows will not be able to answer. So don't bother about that. Okay, so whatever you just need to make sure that you. And then when you go to the case presentation, actually I took the exam in Guwahati. Dr. Kasturi Bhattacharya was my examiner. So honestly, I don't know the language. So it's better if you take the interpreter to ask questions from the patient. And if the patient has any images and all, you can take a look at that and you can get a clear idea of what the case is. And just like how you did in your PG exam, you need to present the case. And your discussion will be there. And all the stations and the likely possible aspects that you need to concentrate on have been already highlighted by Dr. Swati, and also clearly told by Dr. Preeti, who has been an examiner herself. So I would like to add that you have sufficient theory knowledge, you have your practical experience, back it up with your theory knowledge, and you'll be able to clear the exam. So don't panic, don't worry. Whatever you have gained so far is there in the hard drive. So take the exam in a cool way and you'll be able to crack it. All the best.
I think that's a lot of encouraging words from ma'am. With that, some concluding remarks by Loganathan sir regarding the exam as well as the entire session and his take-home points.
So, so first I would like to thank all the speakers for their enlightening and different subspecialty. And the take home is, as Dr. Pritish is my immediate senior in my RIO. So whatever you do, the basic is very, very important. Whether it is in the theory, so almost 50%, whether it is theory or Viva or ASCII, 50% from the basics. What you learned in the post-graduations or residency period. The remaining 25% you cover up to the next level. Don't bother that last 25% in the exam. So next to 25% maybe at mid level in the difficulty one. So you cover up that 75% to 80% you answer in a theory as well as Viva or ASCII. There is nothing, so everyone will be gone through the exam. So basic, don't make any blunders in all aspects. So what I don't suppose you're thinking about one question goes wrong in the first asking, the remaining questions also will be. So don't we have 9 questions next so that you can go through that. And similarly, the tips like you don't know what is the picture, read the questions and go back and look at the pictures again. You will get some idea. From that you can answer it. And regarding the doses where you not seen the procedure, there are certain things, common diseases, we need to know what are the procedure available. So at least go through watch the videos, like many videos like I Focus, where Santosh has put all the videos. You can go through that, you can able to identify the instrument, which surgery, which instrument have been used. The common clinical condition we need to know. Leave the rare syndromes or rare diseases, we don't bother about. What is available in the community, what you are going to practice in the subspecialty, that is more important. So some of the rare syndromes are complicated cases or complex cases where you involve multiple specialty, you need not bother. At least Dr. Preeti pointed out correctly, don't do the harms unless you know where you are limit. So that two level we expect to in the exams. So I think our president has brought the right thing at the right time. There are also the MS examination also coming in few months. So that will be very useful for all the, apart from Faico fellows, it is also useful for the those who are doing the final year MS or MD in ophthalmology. So I wish all the best for the exam appearing both the fellowship as well as in the degree examinations for the successful career. Thank you for the opportunity.
Thank you so much, sir. I'd like to hand over the mic back to Nishant, sir.
Next, we will be having the certificate distribution by our friend Dr. Nirmal Frederick, sir. Sir, can we start the distribution, sir? Few words from you,
yes,
and then we
Prasanna.
can. Yes, sir.
Sure. So let me thank all of you for contributing your time, energy, and expertise for this enlightening webinar. As many of my colleagues said, and we took up the exams, there's no such programs or guidance. Thankfully for Faico, I was considered as old as to get honorary Faico. So I escaped this exam, even though I took many other exams. So any exams brings with it a lot of emotions, both pressure, stress, And of course, when you complete it, a lot of relief. And when you pass with flying colors, a lot of happy hormones. So same way here, when we planned this webinar, so we thought one webinar for one exams. So how are we going to do this? Whether we'll be able to complete this, because many specialities and involving so many experts and teachers. But I think with A.K. Grover sir joining in, sharing his wisdom, right from formulating the syllabus to taking this entire collegium forward. So when we started, it was way back. It was very primitive. I think there was only few specialties: comprehensive ophthalmology, glaucoma, and Faico and retina. And then over a period of time, the specialties all joined, and now we have a very robust collegium system going on. I'm happy about the progress, and happy to see a lot of young ophthalmologists taking the exams and growing up in a big way in the concerned subspecialty and super specialty. So I should thank the senior teachers for taking their time to help the juniors and upcoming young ophthalmologists. So my sincere thanks to Dr. Rajalakshmi, Dr. Nirupama, and Dr. Preeti. So not only doing excellent practice, but also doing wonderful teaching job, helping the young ophthalmologists in their journey. I also congratulate our energetic young ophthalmology team, led by Nishant and Prasanna and Abhijit. So thank you all for bringing your collective experience and energy, the young and youthful energy, to make up this, not only this webinar, but also the program, the full program since August 24. So my pleasure to have our former treasurer, Dr. Loganathan, is also not only a good administrator, but also a very passionate teacher. Loganathan, Logu, thank you so much for your time. So this is your certificate. And Dr.
Thank you,
Grover,
sir.
yes, Logu.
Sir, thank you very much for the opportunity. Really, the Viva is firing across the India. Maybe in future they fire all over the world with their enthusiastic energy and advice from the dynamic leaders. So I am grateful to always to our association, and thanks for the opportunity, sir.
Thank you so much. And the next certificate, Dr. Grover is not with us. My sincere thanks. I think Tushar would share our gratitude and thanks to Professor A.K. Grover for his insights and keynote address. And Dr. Sishir, thank you so much for your contribution and talk on retina Faico exams.
Thank you, sir.
And to Tushar Grover for the cornea Faico exams talk. It was a wonderful talk, Tushar. Congratulations. Thank you so much.
It was a really concept and a really nice idea, and glad to be a part of it.
Thank you, Tushar. And Dr. Shayans Jain, again, UVA is generally a dry topic. You made it look easy and very relevant to the students. Thank you so much. And Dr. Jain Khatib, giving a wonderful talk again in this Yo panel. Thank you for continuously being part of this. Dr. Rinal Pandit, a wonderful talk on glaucoma.
Thank you, sir. Thank you.
And Dr. Swati and Dr. Gunjan Saluja, that was, I think, the last speaker on pediatric ophthalm. A nice and very crisp talk, Dr. Gunjan. I enjoyed
Thank you, sir.
the content.
Thank you.
Thank you so much. And to our senior colleagues who are part of my postgraduate students and young friends, Dr. Rajalakshmi, Dr. Swati, and my illustrative junior, Dr. Preeti Uday. Thank you so much. I'm honored to present you this certificate.
Thank you. Nishant wanted to reiterate that we have crossed the OC age and entered the senior panel.
Oh, okay. No, I think it's a wrong thing because I always tell my friends beyond 50 it should be minus.
Yes, that's what I told Nishant.
Yeah. So it's only 30 plus experience.
Yes.
What do you say, Nishant? You will soon join us also.
Agreed, sir. Trying to be new as much as possible.
Yes. So and the yoga panel, Dr. Neha Mohan, Dr. and this is to Dr. Nirumappa. Thank you for joining us from Jipmer, Dr. Anujit. So active participation, not only in coordinating the entire show. Thank you so much, Anujit. Thanks for your hard work, and it was really wonderful. And big round of applause to Dr. Prasanna. So he's the one initiating all those things, ever enthusiastic and ever online. So thank you, Prasanna. And of course, Nishant is the torchbearer of this your team. Thank you, Nishant. And so this certificate to Dr. Shraddha Sureka. Thanks for your contribution. Dr. Shruti again, very active in the academic front. So
Thank you, sir. Thank you.
yeah, next. So Dr. Neha Mohan, thank you so much for your contribution. Dr. Sindhuja, congrats, and Dr. Mainak B. Thank you so much. Shweta.
Yes, sir.
I think that completes.
That completes.
So I'm very happy to present this e-certificate. I hope we are offline to give you a physical gift and certificate. Unfortunately, this online thing doesn't allow. So hopefully when we meet sometime, I'd like to congratulate and thank you all personally. So once again, thank you so much. And importantly, my best wishes and for all the students and the young ophthalmologists who are going to take the exams. So this is our part in your journey, what we can do as seniors. So all the best, take all the resources well and do well. In the meantime, try to enjoy learning and don't don't get stressed out. So that would be our words of wisdom because exams are indeed stressful experience. But over a period, when you keep on taking this, that gives a lot of experience as well as that actually holds good for your entire practice and profession. So a big thanks from all of us and best wishes for your exams. So thank you all so much for sharing your time and energy for this TNOA activity. We'll meet up in some time, probably next Thursday. So when you are stressed out, it's time for attending some wellness program. So next Thursday, please join us at 7:30 p.m. We have a wonderful expert panel and expert speaker, Dr. Priya Chokalingam, joining us to give to share her wisdom on this non-communicable disease and how we can protect our health and also go through the wellness pathway. So thank you all and good night.
Just two more people, sir.
Okay.
Numerotech team for all the tech support and our flyer designer, Mr. Bala, sir. Always, every time I keep disturbing him for unique designs of our flyer. I think all our 5 flyers have been well received, and I think Mr. Bala deserves all the credit.
Yes.
So those two people.
Convey our gratitude to Bala, the designer Bala. So
yes.
I'll also send him a message, and of course. Yes, the background work of Numerotech has to be appreciated. Thank you, Manjula and Sai. And we would expect your continued support throughout the year. Thank you so much.
Thank you, sir.
Thank you.
And Prasanna will be giving the certificate in the group, right?
Yeah, he'll be sharing in the group.
So we'll be sharing, so all of you can download your certificate.
Yes, download it.
Thank you all.
Manjula ma'am, we can close the live. Yeah.
So Prasanna, thank you. Nishant, thank you for the.
Okay, thank you, sir. Thank you, sir. Thank you, sir. Thank you.
Thank you all.
Thank you, sir.
Thank you, sir. Renal.
Bye.